Welcome back. I want to take a moment to address something that many travelers and expats are quietly thinking about right now, myself included. We've seen how quickly global conditions can shift from regional conflict to sudden global instability. This episode isn't about politics. It's about health preparedness. I'm Nicole Wright, the Zen RN, a registered professional nurse and global health coach. My focus is helping travelers and expats think clearly about healthcare access across borders. When instability increases, healthcare access can become difficult and can change faster than most people expect. So here are a few grounded things to understand. First, healthcare systems can become strained. Hospitals may be overwhelmed, supply chains can become disrupted, medication availability may shift, staffing levels can fluctuate, and infrastructures like electricity, transportation, or internet can become inconsistent. In unstable environments, access often changes very quickly. That's why preparation matters before you travel. One helpful step is building a basic personal health file that travels with you. Now, this can include a list of your medications and dosages, key medical conditions and or allergies, your emergency contacts, very important copies of important prescriptions, and any recent test results or provider notes. Having that information accessible both digitally and in print can make a big difference if you need care in an unfamiliar system. Second, evacuation is not automatic. Airspace can close, borders can restrict movement, commercial flights can become limited. Travel insurance is not a geopolitical extraction plan. Evacuation decisions are based on medical necessity and logistics, not on headlines. If adequate care is available locally, evacuation may not be approved. That's why it's helpful to think not only about insurance coverage, but also about the local healthcare environment in the places you're traveling or living. Knowing where major hospitals are located and how to reach them, various routes to reach them, that preparation can provide additional peace of mind. Third, medication continuity matters. If you live with a chronic condition, it's wise to think about medication planning ahead of time. So some practical steps include bringing an adequate medication supply whenever possible, carrying medications in their original labeled containers, keeping a printed medication list with you, and again, storing digital copies of prescriptions or medical summaries. When systems are under pressure, documentation helps protect continuity of care. Fourth, communication planning is part of health preparedness. So it's helpful to enroll in your embassy's travel advisory system, share your itinerary with someone you trust, keep important contact numbers accessible, maintain reliable communication options such as a local SIM or international plan. Instability doesn't always mean immediate danger, but it does mean that information can change very quickly and communication becomes more important. Another helpful layer of preparedness is situational awareness. Now, some travelers choose to monitor conditions through global risk intelligence organizations such as Crisis 24, International SOS, or Global Rescue. These services track developing situations, they provide alerts, and sometimes assist organizations or travelers with planning and response during disruptions. Now, not everyone needs a service like this, but knowing that these resources exist can be very helpful for people living abroad or traveling frequently. And fifth, you want to consider a small personal health kit, emergency health kit. Now, this doesn't need to be complicated. Many travelers carry a basic kit that will include over-the-counter medications for pain or fever, oral rehydration salts, basic first aid supplies, and any personal medications you rely on regularly. These small steps can help bridge gaps if local access becomes temporarily limited. Finally, assess your own risk tolerance. Before traveling, it's helpful to consider proximity to active conflict zones, government travel advisories, infrastructure stability, and your personal health needs. Prepared travel is not fear-based, it's informed. And staying grounded means preparing thoughtfully so fear doesn't make your decisions for you. Global mobility is still possible, living abroad is still possible, but preparation is part of the foundation. Travel safely and journey well.